Now it's time to test your cord blood knowledge by taking the cord blood quiz. Answer the following 10 questions to see how much you know about cord blood and its possible medical benefits. After each question, we will provide the correct answer. Okay, here we go. Question number 1. What is cord blood? A. The blood taken from the umbilical cord immediately after a baby's birth. B. The blood that is collected from the mother to test for certain illnesses. C. Blood collected from the father for a paternity test. Or D. The blood that is collected from a baby once it is born to test for different diseases. The correct answer is A. Cord blood is collected from the umbilical cord immediately after the baby's birth. It can be collected either before or after the delivery of the placenta. Question 2. What cells are banked from a baby's cord blood? A. Red blood cells. B. White blood cells. C. Plasma cells. Or D. Stem cells. The correct answer is D. Stem cells. Stem cells are the building blocks of the human body. Cord blood contains hematopoietic stem cells, which are building blocks for blood cells. However, recently, cord blood research has discovered evidence that suggests that, under the right circumstances, cord blood may be conditioned to change into the building blocks of organ tissue. Question 3. What are the chances that your baby will need treatment with cord blood? A. 1 in 20,000. B. 1 in 1,000. C. 1 in 450. Or D. 1 in 2. The correct answer is C. 1 in 450. There are many different thoughts on this, but according to non-biased leading experts, the likelihood is 1 in 450 that a baby born today will use its cord blood in its lifetime. Question 4. Which factors are important when choosing a cord blood bank? A. The bank has capabilities to expand its sample. B. Processing is AABB accredited. C. The blood is collected in a bag. Or D. The bank has capabilities to expand its sample and processing is AABB accredited. The correct answer is B. Processing is AABB accredited. The only listed factor that is important is that processing is AABB accredited. Many medical experts are working on technology to expand stem cells, and that is used when the blood is used for transplant, not for storage. For collection, both bag and vial methods are viable collection methods. We prefer the bag method since it is a closed system and there is less chance of contamination, but the companies that use vials have other techniques to minimize contamination. Question 5. Which are important for the security of your infant's cord blood during storage? A. Cord blood storage is alarmed. B. Cord blood storage has video and audio monitoring. C. Cord blood is kept in a locked freezer. D. Cord blood storage is alarmed and cord blood is kept in a locked freezer. The correct answer is D. Cord blood storage is alarmed and cord blood is kept in a locked freezer. An alarm with video and audio monitoring are important so the lab technicians know what's happening in the lab when they are not there. A locked freezer is not as important since the freezer itself should not be kept where it is accessible to non-authorized personnel. Question 6. Collecting cord blood is completely safe and painless for both baby and mother. True or false? The correct answer is true. Cord blood collection is done after the baby is separated from the umbilical cord, and the cord is not attached to the mother. Thus, there is no danger or pain for the mother or baby. Question 7. Cord blood must be stored in a special freezer. True or false? The correct answer is true. Cord blood must be stored in a nitrogen freezer specifically designed for storing tissue samples. Cord blood is stored at -130 degrees Celsius. Question 8. Registration for cord blood banking is a complicated process. True or false? The correct answer is false. Registration for cord blood banking should be simple. While there is some paperwork to complete, you can contact your cord blood banking company for assistance. Question 9. My baby's cord blood can get contaminated in storage. True or false? The correct answer is false. When your baby's cord blood is collected, the doctor will also collect blood from you. This blood is tested for a number of communicative diseases. Any mother whose blood has antibodies for these diseases should have her cord blood stored separately. In addition, some cord blood companies store their cord blood in vapor nitrogen. Vapor nitrogen eliminates any chance of contamination during storage. Question 10. There are companies that specialize in medical transport. True or false? The correct answer is true. Patients should choose a company that has an established relationship with a medical courier service. These relationships allow the cord blood banking company to ensure your infant's cord blood can be traced at any time and will arrive on time for processing.